ED Activity View. This module applies to nurses and assistive personnel caring for patients in all emergency department areas. The goal of this course is to introduce and educate emergency department nurses and assistive personnel about the functionality of Activity View. By the end of this course, you should be able to view medication tasks, document patient care tasks, document assessment tasks, and document other tasks. This video is designed to introduce you to Activity View, which will be available December 20th, 2016 to improve your efficiency with documentation. Activity Event Integration creates a task linking orders from the ED tracking board to clinical documentation in iView. You will be able to document from a task accessed from the Activities column on the tracking board. Tasks will fall into one of four categories: medications, patient care, assessments, and other. When a task is selected, you will be linked to iView or to an associated Power Form to complete the documentation. When the documentation is signed, the task is completed and the associated order is completed, unless the order has a continuous or PRN frequency. Let's look at the tracking board and get oriented to the new Activities column. The tracking boards differ slightly among our facilities. You may see differences in this demo. Keep in mind this project will not be removing or adding any new columns other than the Activities column currently between the Meds and RN Review columns. After you have worked with the new Activities column for several weeks, we will circle back and assess whether to remove any of your existing Med and Tech count columns. For now, these columns will remain. In our demo tracking list, you see we have added the new Activity column. Icons will appear in the Activity column when orders are entered for the associated task type. Let's double-click one of the icons to review the task types. Medications are identified by the capsule icon. Patient care is identified by the cross icon. Assessments are associated with the clipboard icon. Tasks that can be performed by either an RN or certified assistive personnel will be identified by the paper and pencil icon. All task categories will be viewable by RNs and certified assistive personnel. However, certified assistive personnel will only be able to document tasks in the other category. Notice the count is indicated to the right of each category. The count will fluctuate as orders are entered and tasks are completed. To document completion of the task, place a check in the box next to the task you have completed. The options of Not Done and Document will be activated at the bottom of the Activities window. Click Document to be directed to the associated Power Form or iView. For this example, let's select the pulse oximetry nursing and document the following. Oxygen therapy, nasal cannula. 2 liters per minute. Oxygen saturation of 94%. And oxygen sat location, right hand. Sign your documentation with the green check mark when completed. Close the chart to return to the tracking board and refresh the Activities window to see the completed task has been updated on the activities list. Because pulse oximetry is a continuous task, it will remain on your list for easy access when documentation is needed. Let's look at another activity. Select the Fleets enema to document. We will document the following. Enema type, Fleets. Amount enema fluid administered, 230. Approximate amount of enema fluid returned, 230. Enema results, moderate. Stool color, brown. Patient tolerance, good. Sign your documentation with a green check mark and close the chart to return to the Tracking Board Activities window. Refresh the Activities window to update the list. We have seen examples of tasks that link to iView. Let's look at a task that opens to a PowerForm. Place a check in the box to select ED restrictive intervention for violent, self-destructive, greater than 17 years activity and select document. Notice when you sign your PowerForm, it takes you back to Activity View. Refresh the Activity View window to update the activities. Medication orders will appear in the capsule icon and can be viewed in order to pull from the OmniCell. When you are ready to administer, select the MA barcode to open the Medication Administration Wizard if using CareAdmin. Medications cannot be documented from the Activities window. You must either use the MA with CareAdmin or your CareMobile scanning device. However, you can link to the eBroslo reference by right-clicking on the medication task. See separate job aid for additional details. This module has provided you with a brief demo of the ED Activity View. Knowledge of how to use Activity View in the ED will improve your efficiency with documenting care for your patient. Please contact your clinical informatics coordinator with any questions or concerns.